How do cochlear implants work for child hearing? Imagine a child who hears very little or nothing at all because their inner ear, called the cochlea, is damaged. Instead of just trying to make sounds louder with a hearing aid, cochlear implants take a different approach. They are electronic devices designed specifically for children with severe to profound sensorineural hearing loss who don't benefit much from traditional hearing aids. These implants work by bypassing the damaged parts of the inner ear and directly stimulating the auditory nerve with electrical signals, allowing the brain to interpret sound. The way cochlear implants work starts with understanding how a normal ear processes sound. In a healthy ear, sound waves cause tiny hair cells inside the cochlea to convert vibrations into electrical signals. These signals then travel along the auditory nerve to the brain, which recognizes them as sound. But in children with severe hearing loss, these hair cells are damaged or missing, so the cochlea cannot send proper signals to the brain. A cochlear implant has two main parts. The external part includes a microphone and a speech processor that sit behind the child's ear. The microphone picks up sounds from the environment, and the processor converts these sounds into digital signals. The internal part is a receiver and stimulator implanted under the skin behind the ear. It wirelessly receives the digital signals from the external processor and sends electrical impulses through a thin array of electrodes placed inside the cochlea. These electrodes inside the cochlea stimulate the auditory nerve fibers directly by sending electrical impulses that mimic the pattern of natural sound signals. The auditory nerve then carries these signals to the brain, which learns to interpret them as sound. It's important to note that the sounds perceived through a cochlear implant are not exactly the same as natural hearing. They often sound different and requiring the child's brain to learn how to interpret these new signals through practice and training. Most children who receive cochlear implants experience noticeable improvements within months after activation. They can become aware of sounds, understand speech better, and develop language skills. Cochlear implants can also help children hear in noisy environments and improve their ability to participate in school and social activities. Early implantation is usually recommended because the brain is most adaptable during critical periods of development, which can lead to better language outcomes. However, cochlear implants are not a quick fix. They requiring surgery to place the internal device, and ongoing follow-up care is essential. This includes programming the device to suit the child's hearing needs and providing speech and auditory therapy to help them make the most of their hearing. Outcomes can vary depending on factors like how early the implant is done, how long the child has been deaf, and how much therapy they receive afterward. In summary, cochlear implants work by replacing the function of damaged hair cells in the cochlea with direct electrical stimulation of the auditory nerve. This technology opens up a world of sound for children with severe hearing loss, helping them develop speech, language, and social skills. It's always important to consult with healthcare professionals to determine if a cochlear implant is suitable and to ensure proper follow-up and therapy for the best results.